Hey, what's up everyone? This is Dr. David Song at the Rehab Clinic, and today we'll be talking about a topic that's very near and dear to my heart, and that is about rehab programming. So I get a lot of people reaching out to me, especially on Instagram, on which exercises should I do, whether it be for like an ankle sprain, patellofemoral pain syndrome, biceps tendinopathy. I get asked a lot, what can I do to strengthen the muscle or the structure affected? And this is really important to understand that strengthening a tissue is only really 1/3 of a rehab program. It's not just about how strong the tissue is, or in other words, the capacity of the tissue. It's not just about increasing capacity, and I'm going to dig in a little bit deeper about what I mean by that. The exercises that you are prescribed are either going to target one of three aspects of your condition. It's either going to strengthen the tissues, it's either going to mobilize the joints affecting the tissues, or it's about motor patterning. This third one tends to be underestimated, and motor patterning is really a reflection of how well do you move in terms of movement quality. In terms of the mobility aspect, you'll see a ton of exercises out there online. You'll see it on my Instagram page, you'll see it on my exercise database, you'll see it on other people's Instagram pages, and this is about how to increase your joint mobility. And this can be addressed in a few different ways, whether it be a soft tissue mobilization technique, things like foam rolling or using the massage ball to get a muscle to decrease its muscle tone. That can be used to increase your joint range of motion. Stretches can be an effective way for increasing passive range of motion. Mobility exercises can be effective for increasing active range of motion. Where there's the difference between passive and active is that passive, it relies on another thing, like an external force such as gravity, to increase the depth of your range of motion, whereas active is more about you being able to control that range of motion. And so those three things will fall under this more umbrella term of mobility aspect. It's really about increasing the range of motion available at a joint. The second thing that a lot of people automatically kind of think about is strengthening the tissue. And this kind of makes sense. If you have a quadriceps tendinopathy, you need to load it in order to increase its capacity to handle the work or the demand you're putting on it. And this will also stimulate tissue repair. Last component that often gets way too ignored, this is just by the general population, even some therapists are guilty of this, is how important motor control patterning is. So when you're looking at someone and taking an individual and you have adequate strength and adequate mobility, yet you still experience pain, often that falls under this umbrella of motor patterning or motor control, which means you don't have efficient movement patterning or as a skill to complete the task that you're trying to do. A classic example of this is getting some back pain, particularly maybe in the sacroiliac joint, while deadlifting. And these individuals would be able to deadlift up to 300 pounds, for example, pain-free, but all of a sudden when it gets to 350, they experience pain. And it's not a strength issue because they're able to push beyond that. They're able to lift 400 pounds. This individual is strong, the tissues are strong, yet they still experience pain, and you gotta ask yourself why. And if it was a mobility issue, they would get it regardless of the weight being lifted. Motor control type of issues need to be assessed through a movement assessment. Movement assessment needs to be specific to the type of loading they're doing. At my clinic, if someone says, "Hey Dave, I have pain with my deadlift at 400 pounds, you bet I'm going, take a look at their body weight with just a broomstick, barbell unloaded, loaded at the weight that they experience the pain. And often I find that the movement quality, gets worse as you load it more because of factors like fatigue and neural control, but you still see signs of it even at the broomstick level. And this is why it's very important to then dig deep into that issue. When you do something like a deadlift, something from the feet can be affecting the way you're lifting all the way up, or the way you're activating your shoulder and back muscles can be affecting everything going the way down. So you would want to look at joint mobility and strength and all those areas as well. So you can see how when someone reaches out to me on Instagram through direct messaging and they say, "I have pain with my deadlift," I really can't tell them what might be going wrong without actually assessing and seeing that deadlift myself and actually taking a look at all of the joint mobility and joint capacity or muscle capacity to see where along this chain of events there might be a deficit in either strength, mobility, or just a motor control issue. It's about how you control your muscles. It's about, are you activating it at the right time in the right sequence of the chain of muscles along that movement? Are you co-contracting with your antagonist muscles to support the muscles, the prime movers? Are you gaining effective joint stability through co-contraction of your muscles? These are the things you need to start looking at. If you're a therapist, I implore you to learn a little bit more about movement control and assessment. It's something that you really aren't taught in conventional physiotherapy or chiropractic college. This is really where some people can sometimes not receive an effective rehab program because too often you're focused on the site of pain. But the site of pain is really the victim in everything. It's not the culprit necessarily. And we all know that pain and actual structural damage don't always correlate, and actually does not correlate that often. That's why they call it non-specific low back pain, because there is no present pathology in that low back that can explain the issues that are being experienced there. Sometimes you have to look a little bit deeper in order to investigate and figure out what is going on. And if I were to just run through a case study right now, bridging off that deadlift example, if I find through my orthopedic testing that there is a sacroiliac joint irritation, sure, you know which structure is affected, but does that actually tell you which approach you need to take to kind of correct the movement mechanics that this person is doing to allow more efficient loading? There are cases in the world where people are able to lift with inefficient patterning and without pain, but is that to say that that is the most optimal way? Because if you really think about it, it's not just about whether or not they can do this activity with pain. Are they able to complete this with less recovery time? Are they able to progress how much weight they can lift faster with a more efficient patterning? So this is where the argument where why you focus on pain is not just about pain, it's about performance as well, right? And this is where skill development, where someone needs to learn how to do something as a skill, which will help with their issues that they're experiencing. So anyways, this SI joint can be coming from the bottom up. You might have functional overpronation of that same side's ankle or foot, and which will cause internal rotation of the shin and then internal rotation of the thigh, which causes some shifting of the pelvis to get into a more comfortable hip position while you're doing this lift, which will then affect the way that you're able to stabilize through the spine and through the sacroiliac joint. Likewise, coming from the top down, someone with inadequate shoulder rotation when they're doing their grip can affect the way that they're rotating through their spine. So this is where things like lat mobility might be the answer. And their ability to now rotate, or now they're rotating, their ability to stabilize in that rotation may be compromised. So that might be a rotational strength deficit through their spine stability, which can then be excessively loading the sacroiliac joint. And it's these type of issues that when you actually identify the actual culprit behind the movement mechanics, you can actually alleviate pain right away in that lift. I've worked with high-level powerlifters in Canada who compete on the national level, where they would experience sacroiliac joint pain at 250 pounds on the deadlift, and it's consistent every rep. And all of a sudden, I just give their foot a little bit of assistance, and boom, the pain is just gone, right? This is where biomechanics and motor control, and really we're trying to just decrease how much your system is taxed as much as possible, so that your body can focus on actually doing the activity as opposed to trying to compensate something around the chain. And if you're a practitioner watching this right now, trust me, you will not build better patient buy-in with regards to following a rehab program than the patients that experience 100% immediate relief because you were able to identify what the root issue is. All right? So that's what I want to talk about today. It's something that's really important to me. I hope you guys took a lot away from this. If you're a therapist and you have a question about a case, let me know in the comments below, or even message me directly on Instagram. If you like the content that I talked about today, give my channel a subscribe and keep a lookout for more content that's going to be similar. See you guys next time.